remove from the wound.
So, debridement means removal of the dead tissue or damaged tissue, right, on the surface. Okay, like wound, if any wound was formed dead tissue or damaged tissue, they will remove the use of knife or scalp or chemicals. Okay, debridements are two types: excisional debridements, non-excisional debridements. Excisional, non-excisional debridements. So if they perform debridement by using chemicals called as non-excisional debridements. If they used scalp, blade, like instrument, it was comes under excisional debridement. Clear? Excisional and non-excisional difference.
Yes, sir.
Yeah. So non-excisional debridement code 99607, only one code you will get. Okay. Leave it about the non-excisional. First we can discuss excisional debridements. So excisional debridement, when you are coding excisional debridement by using scalp or knife. So first thing, remember, you need to check depth of the wound. At what level they done debridement. Depth of the wound. Okay. In this concept, you will get one multiple choice question. Okay. So first you need to check depth. Tell me what the depth we have. Skin, subcutaneous, muscle, tendon, fascia, bone. This is the depth. Okay. You need to check the depth. At what level they done debridement. Then centimeters. Okay. Size, centimeter. Size you need to check. Then single wound or multiple wound. Single wound or multiple wound. They perform debridement on the visit. Okay. So first, remember guys, if they perform debridement single wound, what you need to check?
Depth.
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 Performed single wound debridement, you need to check the depth and size of the debridement. Then you will get a code, right? They done skin level debridement or subcutaneous level or muscle level or tendon level or bone level, fascia level. How many square centimeter they performed, based on that you will get a code. Correct? See. Debridement including removal of foreign body at the site, open, fracture. These all are fracture related. From here you will get correct code. See, debridement subcutaneous tissue, first 20 square centimeter, each additional 20 square centimeter. Then debridement muscle fascia, first 20 square centimeter or less, each additional. Then debridement bone, right? Bone, muscle fascia, skin, subcutaneous tissue. So based on that, at what level they perform debridement, you will get the code, right?
Yes, sir.
Different code. Then
Shiva.
check. Yeah. Then check square centimeter how much? First 20 square centimeter. For debridement of skin, check here. 97597, 97598. If they're done debridement for skin, you need to check these codes. Okay, epidermis or dermis only. See these codes. If it was subcutaneous tissue, then you will code 1104. So one thing remember, when you are coding, first you can check any underlying. Below they given any tips, coding tips. These are important. Okay, like this. Okay, these codes should be important. See, for debridement of burn wounds, you need to select from here. Like that, they will give some tips. You need to follow that. So, subcutaneous tissue, muscle, bone, 20 square centimeter. Then each additional 20 you will get here. No? So, for this, you need to follow guidelines. So, if they done single wound debridement, muscle level, bone level, tendon level. Okay. In single wound debridement, multiple depth they documented. So at that time, which depth you will take? You will code all three depths separately, or you will go with deepest level, which means we need to code only deepest
Bone
level
level.
debridement. Okay. Deepest level enough. No need to code all. This tip you can read, it will be helpful. When performing debridement of a single wound, report depth using the deepest level of tissue removed. Okay, you need to follow the deepest level, depth. Then in multiple wounds, sum the surface area of those wounds are that are at the same depth, but do not combine some from different depth, which means if single wound they perform multiple depth, code deepest level. So here patient perform debridement on left hand, muscle level, tendon level, bone level. How we will code the scenario? Options: code bone level debridement, code muscle level debridement, code tendon level debridement, code all three separately. What is the exact answer?
Bone level only.
Okay, code bone level debridement. Now, multiple wound we can discuss. So in multiple wounds, if they performed debridement, same depth, like two wounds performed subcutaneous depth. Two wounds, subcutaneous depth. Each 20 square centimeter. So how you will code?
42 with 59 modifier.
So here you will sum the length or you will code separately that wounds.
Sum the length.
Sum the length, right? Both wounds are same subcutaneous. Correct?
That time add.
You need to sum the length. So which means you need to code for 40 square centimeter. 40 square centimeter, you need to code subcutaneous 11042 and 11045. For plus symbol codes, no need to give modifier, add-on codes. What you will
Sir,
get? Hello?
if they given in centimeter, like each 20 centimeter they given means that time we have to convert that centimeter to square centimeter, no?
Yeah, each 20 means two wounds I said, na? Each means one wound 20 square centimeter. So
No, I'm
total,
telling in question papers if they mentioned wound debrided 20 centimeter, not 20 square centimeter. That time we
same
have to.
20 square or 20 centimeter, both same meaning. Okay,
Okay.
don't take convert that one. Okay, they will give same 20 SQ centimeter only will get. They won't mention like this. Here, remember, you don't get coding. You will get guideline related question. Okay, you don't get codes. You will get guideline related in exam, but I am explaining here. So now multiple wounds, same two wounds debrided, perform subcutaneous and muzzle level. 20 centimeter, muzzle 20 centimeter. How you will code?
11042 along with the 11045.
See, here both are depth was changed, right? One was subcutaneous, one was muzzle level. No?
Yes.
Then you need to code individually. One 11042, then muzzle level
11045.
11043. Clear? Single
With
wound
mod
level.
Shiva, come again, Shiva. I didn't get that one. 11043.
See here, in 2 wounds debridement performed. What is the depth? Subcutaneous and muzzle,
muzzle
right?
level.
So both are different. 2 wounds. One wound was closed with, one wound was debrided up to subcutaneous level. Another wound debrided up to muzzle level. Then both wounds are same level depth or different level here.
Different.
So
Different.
when the multiple wounds documented with different depth, individually you need to code. Then you add modifier. Okay. So when they given 2 wounds, sum the length. Different depth, different wounds, code individually. Single wound, multiple depth, code deepest level. This is the debridement guidelines. Clear?
But here the depth is same, right? At subcutaneous level and muzzle level.
Depth is
Muzzle and fascia, no? Subcutaneous you will get code 11042. Muzzle and fascia you will get 11043, right? Different depth, no? Where is the same depth?
20 centimeters is same, right?
Length was not a matter here, no? Depth first you need to check, right? At what level depth they are performing, you need to check first, no? First, don't check depth, length. First check the given single wound or multiple wound. First point, okay? Then, if they're given single wound, what you need to check?
The deepest level.
They done depth. How much depth they done? Code
Okay.
deepest. Then check the length. How many square centimeter they perform. Then, when multiple wounds they done, check. All the wounds are done. Debridement same level or different level. Okay? Same level debridement means all are sum the length. Means you can club the length and take. If different depth, code individually. Clear? Do you understood or not?
Yeah, clear.
So debridement topic, you will get one multiple choice question and one more multiple, 2 questions you will get. So when you are coding debridement, what they need to mention compulsory in the procedure now?
That which level they conducted, single wound or multiple wound?
No. Single wound or multiple wounds, if they didn't mention also, will get the code right. If they given debridement performed on right thigh, this document is enough to code.
With this,
In the operative note, they mention debridement performed on right thigh using knife. This document is enough to code the debridement.
no.
Yes, is an
Depth of debris.
Type
See,
and
Length.
level is necessary.
type knife means sectional. So here depth compulsory, no? They didn't mention the depth. Then which level of depth you will code? Based on the depth, you will get different code, right?
Yes, sir.
If they didn't mention length, you will take minimum length, 20 square centimeter or less. If they didn't mention depth, you need to raise the query. You need to raise the query, which means you need to send to back the provider to ask the debridement. So when the didn't mention depth or type, if they didn't mention depth or type, you need to raise the query. If they didn't given how they perform debridement, then you need to raise the query for type also, either excisional or non-excisional. If they didn't mention depth, then you need to raise the query for depth. Okay. In this debridement concept, you will get guideline related to questions, guys. Not coding, guidelines. They will ask, patient performed debridement on multiple depth. How we will code on single wood? How we will code? Code deepest level. Code bone level means bone level. Then patient performed debridement on the certain body part. They won't mention type and depth. Then can you code or you need to raise the query?
Query.
Query for type and depth of the debridement. If they mention type, you need to raise the query only for depth of the debridement. If they didn't mention type, then you need to query for both type and depth of the debridement. Clear?
Yes.
Yes, only ask guideline or a CPT.
Guideline they will ask actually in exam. If they asking CPT also, I explained, na?
Yeah, no issue.
These two was multiple related to debridement. Clear? So next topic we can. Remember, I am explaining important topics related to CCS exam. Because now the CPT you don't get much more. Next topic, removal of skin tags. Okay, removal of skin tags. Skin tags removal. Hello?
Related connection, we will get any
I didn't get what you were saying. Related?
related connection. That's not the way.
Sorry, I didn't get what you are saying exactly. At least you can text me. Anyone getting her voice?
No, no.
It was completely breaking. You can text in WhatsApp or somewhere. I will. Or here also you can open chat. In chat also you can tell. So next topic, removal of skin tags. Okay. So for skin tags, any method like scissoring or sharp method ligature, any method, if they remove skin tags, we have only two codes. 11200, 11201. Based on the lesions, how many skin tags removed? Based on that, you will get no question related to non-excisional debridement. Okay. So next, removal of skin tags, multiple fibrocutaneous tissue tags, any area up to 15 lesions, 11200. Each additional 10 lesions, what is the code?
11201.
201. Plus symbol means
add-on code.
add-on. So here, based on the skin tags, how many tags they removed? Based on that, you will get code. Suppose patient performed 5 skin tag lesions. So patient performed 5 skin tag lesions. What is the CPT code?
11200.
11200.
11200.
Double.
11200 and 3 times 11201.
We need to
See.
code only 11200.
See what they mentioned here. including 15 lesions, right? Up to and including 15 lesions, which means
Up to 15 we will consider 112.
Only one code.
only
1120.
one code up to 15 lesions.
Only one code.
Yeah, if they mentioned beside each means, then you need to select for each lesion one time. Clear? So please put it mute. No?
Hello, sir.
Yeah.
Sir,
Hello.
will you please repeat this?
Yeah, sure. Remember, here skin tags, you need to code based on the lesions. How many lesions performed? So 1 to 15 lesions, 1 to 15, including 15th lesion, you need to code 11200, 1 to 15. So then each additional 10 lesions, which means 16 to 25. 16 to 25. Okay.
Okay.
Okay. Suppose if they mention 24 lesions debridement, 24 lesions skin tag removal.
11200, 11201.
Yeah, 11200, 11201. Okay. So here one multiple choice question you will get in exam. 24 lesions performed.
So we should give only 11201, right? Why should we give both the codes?
How we will code add-on code sim directly? Plus symbol means what is the meaning?
Add-on code.
So you never code add-on code as primary, right? Or alone.
Okay.
I given in the symbols day, no?
Hmm.
I mentioned, explained, right? On the symbols meaning. So plus
Yeah.
symbol.
So we need to mention the add-on codes with the original code.
Always.
Yeah.
Add-on code you never code as primary. Remember here. Use 1120 in conjunction with
Okay.
11200. Means along with 11200 only you need to use 11201.
Okay.
Clear? So they mentioned 16 skin tag removal.
We need to add both double back to the 00.
11200, 11201.
201.
But in this case, we are adding the 10 lesion, no? Won't it get like conflict? We are adding more than we are supposed to.
Like tell me one example. Like
Like the
26.
one you said. Yes,
Suppose
26.
then 26 or 30. Then into 2 add-on code. Okay. Suppose they done 30 lesions. Okay. Then what is the primary code?
11200.
11200 up to 15 lesions. Then 11201 for 10 lesions, which means 25. Again 11201 into 2 times. Okay. You can multiply add-on code for each 10 lesions. Okay. 1 to 10 lesions.
Okay, so we just need to achieve the maximum number. It doesn't
Yeah,
have to be accurate.
there is no may. It depends on the lesions. You can multiply the add-on code.
Shiva, could you
Clear?
please repeat this 30 lesions?
Suppose if they perform 30 lesions, here up to 15 lesions, 11200, right? CPT,
Yeah.
primary
Yes.
code.
Yes.
Then for each
Yes.
additional 10 lesions, 11201. Na? So
Yes.
15 to 10 means 25. Na?
Hmm.
So
25.
remaining 5 lesions, again you need to add add-on code. One more add-on code.
Okay.
Into 2, or you can add again 11201. Same. Okay.
Okay.
You can go like this or add into 2 multiplies also no. So here you will give 59 modifier for add-on code or not?
No.
No. Okay. Modifier not required here. So one option you will get 11200 Clear?
Okay. Yeah.
So one option they will give 11200 with 59 modifier. Which one is correct?
Without modifier.
Without.
Without modifier.
Without modifier is the correct.
Do we use add-on codes with modifiers, sir?
No need. No modifier for add-on codes. Clear?
Shiva.
Thank you guys. So next topic, lacerations. Okay, in this topic, remember you will get one case scenario. Okay. The lacerations you will get one case scenario. Repair closure. So laceration means simple wound closure. Sutures, okay, stitching, sutures. If anything happened to cut your hand, what they will do? They will suture the hand wound. They will close that wound, right? By stitching. Sutures. Okay. Repair means skin repair closed with the sutures. In this concept, we have guidelines. Remember carefully this concept. You will get one case scenario and one multiple choice question in this concept. Laceration repairs. So first thing, laceration means wound closure, okay? Wound closure. So when they are closing wound, they will use the material, right? Stitching material.
Yes.
Thread they will use for closing the wound. Suture means they will use the thread, right? Some material. So here, remember, what are the materials we can code, what we should not code. Okay. See. Wound closure utilizing sutures, tapes, or tissue adhesives. Okay. You can code tapes, sutures, tissue adhesives. Or either singly or combination with each other. In combination with the adhesive strips, chemical cauterization, electrocauterization, or wound closure, utilizing adhesive strips or the solid material are included in the appropriate ENM code, which means if they using wound closure with chemical cauterization, electrocauterization, wound closure utilizing adhesive strips, sole means single, alone. Sole repair material are included in the ENM. No need to code separately repair code. If they closed wound with these materials, it was included in the ENM means office visit. Okay, in the office visit only it was included. No need to code separately means they won't get the bill for procedure. Electrocauterization or chemical cauterization means they will put some chemical to close the wound. They won't get any payment. Okay, if they used stapes means for scalp repair, they will stitch with stapes. Okay, like pinnul antaru kada. Then sutures and adhesive tissue adhesives. You will get the payment for they done repair with these methods. If they done repair with chemical cauterization, electrical cauterization or wound closure, they won't get the payment. It was included in the ENM code. So one more thing, if they closed wound with steri strips, it also included in the ENM. No need to code again. Steri strips. Clear? So while you are checking the document for repair, you need to check the wound close with which material they used for the wound closure. Clear? If they done with these materials, it was comes under codable category or not included in the ENM. If it was included in the ENM, no need to code any procedure. Okay. If they done laceration repair with chemical cauterization, can you code laceration code?
No need
No.
to.
No
No.
need.
No. If they done laceration repair with stapes, then
We can.
staple method. Staple means we need to code. Then type of repair you need to check, guys. Type of repair. Next concept. So total 3 types of laceration repairs. Simple, intermediate, complex. Okay, in these 3 types of laceration repair you need to check. So first, simple wound repair. Simple repair is when the wound is superficial. Example involving primarily epidermis or dermis subcutaneous tissue without significant involvement of deeper structures, which means superficial layers of the subcutaneous tissue. So when you need to code simple repair, it was dermis or epidermis or subcutaneous superficial layers. Okay, then simple repair, okay, requires simple one layer closure. They will done simple repair or one layer closure, single layer closure. Actually, how they will perform single layer closure? No, they will administer some local anesthesia or topical anesthesia on that site, and they will close with the suture material. Okay, with one layer closure. It was simple repair. Then intermediate. Intermediate means, remember, simple repair means single layer closure. Depth was
Dermis and epidermis.
Deepest
dermis,
level.
epidermis superficial of the subcutaneous tissue. It does not enter to the deepest subcutaneous tissue. Intermediate means deeper layers of the subcutaneous tissue. And fascia. Okay. Deeper layer of the subcutaneous tissue and superficial fascia. Okay, fascia. This is the depth. Actually, you can decide here also based on the depth of the wound only, laceration repairs. Okay, this chapter 1 all related to skin and breast related. So maximum here you will get all skin related procedures. Here you need to remember depth also. All are comes under based on the depth. Then if they mentioned layered closure, require layered closure of one or more of the deeper layers of subcutaneous tissue. If they mentioned layered closure also, you can code as intermediate repair. Is this single word enough to code as intermediate layered closure? Okay, this single word enough to code as intermediate repair. Then 2-layer closure. 2-layer closure, which means they will close the wound with 2 layers. Like subcutaneous tissue, first they will close, then they will close skin level. Both they will do. 2-layer closure called as intermediate. Then sometimes single layer closure also you can code as intermediate. Okay, single layer closure of heavily contaminated wounds that have required extensive cleaning or removal of particulate matter also constitutes intermediate repair, which means that wound was heavily contaminated. If they done extensive cleaning, generally when you are closing the wound, they will clean the wound. It is a common thing. Like they will do sterilization on the wound, but heavily contaminated that wound, then they will do some workup, then they extensively clean the wound. If you seen this heavily contaminated or extensive cleaning words in the document, even if they're done single layer closure also, you need to code as intermediate. Then if they remove any particulate matter, means like foreign bodies like glass particles, anything on the wound, they remove that, all means comes under intermediate repair. Clear? Single layer closure with foreign body or heavily contaminated. Yes, intermediate repair. So complex repair means here must be exposure of bone, cartilage, tendon. Okay, either any one of the following: exposure of bone, cartilage, or tendon, and debridement of wound edges. Debridement of wound edges, like they need to do debridement wound edges, they need to remove the tissue. Remember the exposure of bone, fascia, bone, cartilage, tendon, and debridement compulsory to code complex repair. Okay, debridement already also included in the complex repair. No need to code debridement separately. Okay.
Can you repeat this?
Complex repair.
Yeah.
So when they are done debridement,
Okay.
when they're done complex repair, when you need to code means depth check first. Depth was exposure of bone, tendon, cartilage, and they need to perform debridement compulsory of the wound edges. Then you need to code as
Complex.
complex. So simply depth, based on the depth. So up to superficial layer of subcutaneous tissues, simple repair. Fascia, subcutaneous tissue, deeper layers, intermediate. Exposure of bone, tendon, cartilage,
Complex.
Complex repair.
complex. Then now you understood, right? Type of repair. Simple, intermediate, complex.
Yeah.
Okay. Then after that, you need to check length. Type. After type, you need to check anatomical site. Which means location of the laceration. Location of the repair. Where it was located, like skin in the body, like hand, leg, ear, scalp, where it was happened, that wound, trunk, wherever it may be. After that, you need to check length, size. Example 2 centimeter, 3 centimeter, 5 centimeter. How much they done repair. If they didn't mention length, take minimum length. 2.5 centimeter or less. Okay. So you need to check three things, guys. Type of the repair, anatomical location, size. Before these three, you need to check what material they used for the repair. If they used some materials like chemical cauterization, electrocauterization included in the ENM service, then no need to code procedure. So you no need to read the document itself. Okay. If they done codable material for the suture, then only you need to check remaining all the things like type, anatomical location, size. Clear?
Yes.
Thank you.
Thank you. Now we can discuss codes here. Read this line, sum of lengths of repairs for each group of anatomic sites, which means
Each anatomical location having a different code.
each
We have to
anatomical
add
having different codes. Some mean you need to add the length if the repairs of each anatomic group. If they done multiple repairs on the same anatomic groups, you need to add the length here. Okay. Based on the anatomic sites, you will get the codes. Read the description of 12001. Simple repair of superficial wounds of scalp, neck, axilla, external genitalia, trunk or extremities, including hands and feet, right? 2.5 centimeter or less. So, if they done repair on the scalp 2 centimeter, neck 2 centimeter, then how we will code?
We need to add
12001.
12001, then
12001.
you will code 12001 two times.
12002. 12002. We should go.
See here, two. Both comes under same anatomic site, na? Same anatomical group, right? Scalp and neck. So if this same anatomical site means what you need to do? Sum of the length.
Add.
So 2 into 2. You need to add both 4 centimeter. For 4 centimeter, 2.6 to 7.5. What is the code?
12002.
002. You need to code like this. Okay. So you need to check the anatomic site. If single wound, no problem. Hello? Hello? Tell me. Yeah. Remember, guys, single wound, no problem. Like one laceration they done, you say check the size, where it was located. You will go with the anatomic site, you will get the code. When they performing multiple lacerations, their only problem. When they performing multiple lacerations, then only problem. Okay. See, when multiple wounds are repaired, add together the length of those in the same classification. If they comes under same anatomical site, you need to take the length, sum the length. And from all anatomical sites that are grouped together into the same code descriptor. For example, add together the length of intermediate repairs to the trunk and extremities. Do not add lengths of repairs from different group of anatomic sites, which means one laceration on scalp, another laceration on face. Face was included in this anatomic group. No, right? So you need to code separately for that. Like see, one example they given, a face and extremities. These both are not comes under same anatomic site. do not add together lengths of different classification, which means if the anatomic site was changed means don't add the length, don't sum the length. When more than one classification of wound is repaired, list more complicated as the primary procedure and the less complicated as the secondary procedure using with 59 modifier, which means they done multiple lacerations. Which one is more complication on that both? Then code as primary. Lesser one code as secondary along with 59, which means complex repair first, intermediate then okay. Repair and one simple repair. You need to code first intermediate repair. Then for simple repair, you need to add modifier
59.
59. Clear? So now we can practice examples. I already shared the CPT book with you in group, right?
Yes, Shiva.
Yeah.
Yes. So please take, we can practice now examples. See, one more anatomic group, 12011, simple repair of superficial wounds. Okay. Then in simple repair, you will get two anatomic groups. In intermediate, you will get three anatomic groups, 12031, 12041, 12051, depends upon the body parts. Like 12051, intermediate wound, face, ear, eyelid, nose, lips. Then here 12041, neck, hands, feet, external genitalia. Here scalp, axilla, trunk, extremities, excluding hand and feet, 2.5 centimeter. Depends on that, you need to check. Then complex also you will get here. Okay, based on the size and length, location, you will get different codes. Okay, now I will give examples. You need to identify the answers. Clear?
Yes.
Yeah, thank you. So, physician performed 1.5 centimeter laceration on chin. 1.5 centimeter laceration on chin. Location was chin. Okay. Chin 1.5 centimeters. Closed with single layer closure. What is the CPT?
12011.
120?
11.
Yes, 12011. Because chin comes under face. Okay. 12011. So please check everyone. Are able to identify or not? Same concept. Closed with single layer closure. Amount of cleaning. Extensive. Then what type of repair it will be?
Intermediate repair.
Intermediate.
Intermediate repair. Tell me the code.
12041.
12051.
12051. Face comes under which atomic state? 5. Chin means face, no?
Yes.
12051. Next question. 4 centimeter laceration repair performed on the scalp. Then 2.5 centimeter laceration performed on the hand. Remember, these all are one question only. 4 centimeter on hand, 2.5 centimeter on, 4 centimeter on scalp, 2 centimeter on hand. Locations, okay? Then hand laceration repaired with intermediate repair, scalp laceration closed with single layer closure. Hand was intermediate, scalp was simple. Then
12031. 12031, 12002.
two scalp caused with single layer, no? And only subcutaneous, intermediate.
Yes.
So 120.
1202.
12031.
See,
Hand.
hands were excluding, right? Hands was here, no? 12041, right?
1204.
Correct. Here they mentioned clearly, no, excluding hands. That's why don't confuse, okay? 12041, then 12002, along with 59 modifier. 12002 with 59 modifier. Clear?
Yes.
Any doubt in this concept? You people,
No.
lacerations, debridement, skin tags.
Sir, why we use 59 modifiers, sir? We just simply give the codes, right?
No, when we are coding different procedures, no. Here they mention, see, guideline clearly. Distinct procedures, right? Each one. That's why you are using 59 modifier.
One is simple and one is intermediate. So that's why we are using modifier.
Yeah. Suppose both are simple means, suppose scalp 2 centimeter, face 2 squares and 2 centimeter, they're done. Then what you will get codes? Both are simple repairs, scalp 2 centimeter, face 2 centimeter.
12001. 2011.
12011. Two codes.
12001, 12011. Right? Two codes with 51 modifier. Okay, multiple procedures. Okay, multiple procedures. 51 you need to give. Same anatomic group means 51. Different anatomic group means 59.
No, sure. 51
Which
is totally two different procedure. 59 mean type same, but procedure is same.
Sorry, here they given 15. You can follow 59 as per CPT book only. Okay, 59 only you can. I seen in the data actually. Here they given.
Because 51 is multiple procedure, two totally different procedure, and 59 mean distinct procedure. Procedure type is same, but procedure type different, procedure same.
59 you can give. Okay, distinct between each other. Clear?
Sir, we are confusing about 51, 59. Please, can you explain once, sir?
59 you can give.
When we have to use that modifiers?
59 you can give here in lacerations. Okay. While you are coding laceration, give 59. So, any doubt, simple repair, complex, intermediate repair, complex repair. When multiple lacerations or single laceration given, when they're done multiple lacerations, how we will code? You need to check anatomic site, right?
Anatomical site.
And type of repair.
Repair.
Like intermediate or simple, both are comes under same anatomic or different anatomic sites. Based on that, you will get a code. Okay, these three concepts you will get from the chapter 1, guys. Like surgery section 1.